you think the president was just distracted by the political implications in the campaign?
You know, I always wonder that. And I mean, the worst possible time you can have a pandemic is in a presidential election year. I just want to be frank. There's politics and there's policies and there's pandemics, but an election year, everything takes on a different perspective. I think the White House personnel were very focused on this pandemic in March and April.
There's a lot of confusion among people and misinformation surrounding face masks. Can you discuss that?
The masks are important for someone who's infected to prevent them from infecting someone else. Now, when you see people and look at the films in China and South Korea, whatever, everybody's wearing a mask.
In a matter of days, Dr. Li Wenliang went from treating patients to becoming one. The 34-year-old ophthalmologist diagnosed Saturday with the Wuhan coronavirus, dying less than a week later in the same hospital in which he worked. But if action had been taken when he and others started sounding alarms, the severity of the outbreak might have been understood sooner. Struggling to communicate, Li spoke with CNN briefly by phone on January 31st. You could hear the hospital machines pulsing in the background. It was back in late December when Li first warned friends on WeChat about a SARS-like disease going around. Li sent a group message saying that a test result from a patient quarantined at the hospital where he worked showed a patient had a coronavirus. But hours after hitting send, Wuhan city health officials tracked Li down, questioning where he got the information. Within days, they closed the suspected source of the virus, this seafood market, and they announced the outbreak. But instead of being praised, Li got a call from Wuhan City Police. With Li coughing too much and breathing too poorly to speak by phone, we asked Li by text, "How did you feel when this happened?" "I felt a little afraid I would be detained, afraid my family would worry," Li responded. He agreed to sign this document, admitting to spreading rumors online and severely disrupting social order. It reads, "We want you to cooperate with the police and listen to our reminder and stop the illegal act. Can you do that?" Li answered, "Yes, I can." In the weeks that followed, the Wuhan Municipal Health Commission maintained that there was no obvious evidence for human-to-human transmission, no infection of healthcare workers, and that the outbreak was, in their words, preventable and controllable. And with that, the people of Wuhan continued about their normal lives. Then came a sudden jump in infections. China's central government took over, scrambling to contain a spreading virus with a rising death toll. Chinese state media first reported that Li was one of several whistleblowers silenced by police. Calls for Li and the others to be vindicated grew online. China's Supreme Court even weighed in, adding, quote, "It might have been a fortunate thing if the public had listened to this rumor at the time." But for many, including Li and his parents, it was too late. They all contracted the coronavirus. Li's condition declined rapidly. But before his death Friday, he witnessed the support of thousands online who considered him a hero. Late Thursday night, Chinese state media first reported Li's death. The responses online reflected a profound grief and a deep anger. The two topics trending on Chinese social media were Wuhan government owes Dr. Li Wenliang an apology and "We want freedom of speech." Both had tens of thousands of views before being censored.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet. But it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. But when you think masks, you should think of healthcare providers needing them and people who are ill. The people who, when you look at the films of foreign countries and you see 85% of the people wearing masks, that's fine. That's fine. I'm not against it. If you want to do it, that's fine.
But it can lead to a shortage of masks.
Exactly. That's the point. It could lead to a shortage of masks for the people who really need it.